I think that there are very few things in modern society that the general public has to cope with stress. There are no practices. We are not taught in modern society how to cope with stress, how to cope with emotions. We don't have these techniques in our society. They don't exist. And so as a consequence, people suffer from chronic stress. And chronic stress leads to all of these lifestyle disorders and ultimately to mental health problems like depression and anxiety. And so the only way to cope with this is to have some kind of intervention that helps us cope. And yoga is exactly such an intervention. So I see that it is inevitable. Modern medicine, unfortunately, is focused on treating symptoms. It's not focused on treating the underlying conditions. So much of biomedical research is trying to find the magic pill that will fix obesity, the magic pill that will fix type 2 diabetes, the magic pill that will fix depression. It is a dream that will never come true. You cannot treat an avalanche of lifestyle disease with pills. It's not possible. You have to treat the underlying cause of these disorders. And modern medicine is not a health care system. Modern medicine is a disease care system. You see the doctor when you are sick. And what we need to do is to change that system to a system of prevention. So people are living a healthy lifestyle to prevent these diseases from happening. And the yogic lifestyle is a lifestyle that helps you treat the physical, mental, emotional, and spiritual health of the individual so that disease is prevented. So I see that this is a very powerful way. And when you go into the schools know that they have a problem with their children. When we approach schools with a yoga research study, they welcome us because they know they have a problem. Their students have depression, they have anxiety, they have poor behaviors, they have academic problems, they have attention problems. And the schools have nothing to do, they have nothing to propose that could help these students. And yoga is exactly such a practice. The practice of meditation, the practice of pranayama, of breathing techniques, and the practice of becoming aware of their body and doing appropriate exercises. So I believe that at some point in time, we will have enough research evidence that has been done on yoga in schools that demonstrates that yoga belongs in the school. No, the purpose of the schools is to educate our children, to prepare them for adulthood. So we give them mathematics, we give them science, so that they can get a job and they can function in society. But the schools do not provide them with any lifestyle skills, how to cope with emotion, how to cope with stress. The schools have nothing for this. So if we really want to give our children an education to make them competent, healthy adults, we need to give them these kinds of practices. And yoga, I think, is a perfect practice. Yoga is not a religion. Yoga is a mind-body practice. It is biological. If you meditate, if you focus your attention, if you breathe slowly, if you stretch your body in yogic postures, you will make changes in the body and the mind that are healthful, that will prevent disease, that will allow individuals to cope. And we already see this in our studies. When we interview children and teenagers who have gone through our yoga program in the school, they talk about how they are using yoga in their life. So for example, they will say, when I come to an examination on mathematics or science, they will first stop, they will do pranayama, they will do slow breathing. They will calm themselves down, reduce their anxiety, and then they will do the test. Other students will say that they are prepared for a soccer match. They will stop, do some yoga postures to stretch, to breathe, to prepare themselves, and they will perform better. So they are already using these skills in their day-to-day life. And that's the beauty of mind-body medicine, of yoga practices, is that this is a skill. Once you learn this skill, you have it forever. Whereas in modern medicine, you have to take a pill every day. And then you have to pay for this pill, you have to get the pill. The main problem with pills is that this is treating just the symptoms. It's not treating the underlying condition. And once you treat the underlying condition, the problem is really solved. Pills that treat the symptoms are not a cure. They are treating the symptoms. Let me give you the example of insomnia. Many people who take sleeping pills for insomnia, yes, they will sleep better. But if they stop taking the pills, the insomnia comes right back. So they have not treated the insomnia. They have treated the sleep problem. Whereas if you give them mind-body practices, you change the underlying stress reactivity in the body, and then they sleep better. And they sleep better forever. And if they continue to practice yoga, they will continue to sleep better. So this is a permanent solution. This is truly a cure of the disease. This is restoring the imbalance in the body that's associated with whatever disease it is, whether it is insomnia or depression or anxiety. And so this is the beauty of this. It is a permanent fix. It is treating the underlying condition. It has no negative side effects. In fact, it has positive side effects because people feel better. We have had patients in our study for insomnia, and we speak to them at the end of the insomnia trial when they have practiced yoga, and they say, yes, my insomnia went away. But, also when I started practicing yoga, I also had a stomach problem. And at the end, my stomach problem went away also. So these practices have positive side effects because you are treating the entire individual. The entire individual is coping with stress and emotion, and stress and strong emotions can cause many side effects, headaches, nervous activity, and yoga can treat the underlying cause of this. So this, I think, is a permanent change. It's something that is feasible to implement in the schools, and it is something that can be taught very easily, either by the teachers or by yoga instructors. And I think the analogy is very clear. At the beginning of the 20th century, in the 1800s, it was known what the problem was in terms of dental cavities, that brushing your teeth and taking care of your mouth in a proper way, dental hygiene, was important. This was a big problem in the schools because many of the children had dental pain and could not study and had real problems. So in the early 20th century, in New York State, in the United States, they started teaching dental hygiene in the schools. They brought dental hygienists into the schools to train the children how to take care of their mouth and take care of their teeth. And now in society, this has continued since that time. So now in society, we have dental hygiene as part of our lifestyle. You have a toothbrush, I have a toothbrush. When we travel, we take our toothbrush, we take our toothpaste. Everybody does this. When we grew up, our teachers taught us in school, our dentists taught us in the office, the medical doctors taught us, and our parents taught us how to brush our teeth. It is part of our society. If someone came up to you and smiled and all the teeth were black with cavities, you would say, "What country are you from?" You can't be from Poland or a Western country because we all do dental hygiene. It is part of our lifestyle. You must be from a different country where there is no dental hygiene. It is that much a part of our society. And how did it start? It started by seeing the benefits of dental hygiene and then bringing that as part of the culture into the education system and into the medical system. So now compare this with what is happening with mental health and spiritual health. We have a problem. We have a problem with depression, anxiety in our children and in our adults. In fact, the majority of adults who have mental health problems, those problems actually started in teenage and childhood. We have surveys that demonstrate that. So it is very important to treat these problems in childhood and adolescence.